mental health.
Mhm. Hello? No.
We did.
Well, the biggest.
I don't know. Things are pretty,
Nobody's scheduled.
pretty rocky for kids, I would say.
I can hear people, I can't see people.
We do taxes.
With us?
Yeah.
Environment as opposed to a CPA's office.
He did, I suppose it's so he did, you know, so he joined. us.
Yeah, that's it. Yeah.
And I keep
He's in the.
I can see people, but I can't hear. Hello, hello.
Isn't it?
Yeah,
Okay, everybody, how about we get started since it's
and it's what,
almost, well, it's 5:37. Do we need to do introductions? I don't think we have a guest today, so we probably don't, right? Okay, everybody knows everybody. Next is additions or deletions from the agenda. Does anyone have anything to say? Did you want to say anything, Mary? Oh, Larry, yes.
I'd like to just update people about the previous mental health subcommittee meeting quickly.
Okay, well, you mean when we start the meeting, right? Not
Yeah,
right
yeah,
now.
yeah. Not
Okay.
right now.
Okay. And next is approval of minutes for March 2024. Folks had a chance to look them over. They came with the email. Do I have a motion to approve the March 4th? Did someone say so moved? I did. Okay, so you're a first and you're a second. And any additions, deletions, questions? Okay. Then. Can I, sorry, I'm still like catching on to the evening. So let's all vote and to approve the minutes. All right, thank you. Oh, you still aren't approved?
No, I wasn't here. I abstained.
Oh, okay. You don't officially have to abstain
Okay.
here, but that's fine. Okay, now next is privilege of the floor. Questions or comments from board or guests? We have no guests, so yeah.
We recently in the county have had a complicated situation with a young adult, with developmental disabilities, in the CMC emergency department. It is highlighting some, I don't know, maybe gaps in communication between different entities. Lately, I'm wondering, if we could get like Project Lifesaver to come and do an update for us on their program, or I don't know if it would fit within,
Who is it you want an update from?
Project Lifesaver, which is through the Tompkins County Sheriff's Department. They have, tracking watches for, people who are at higher risk for like running away and not being able to care for themselves. And I don't know if that could like fall under like if Deborah Barber is gonna come join us from the Sheriff's Department or not, because I know it's within the Sheriff's Department, but it's a program that exists that it seems like at least lately there's been some miscommunication in between the Sheriff's Department and the Ithaca Police Department, and we just.
So you'd like to have that as a topic of discussion
Yes.
at a future meeting?
Yes.
Okay, yeah, our person that from the Sheriff's Department hasn't been here in quite a while, actually.
you also be in coordination with the hospital when they bring one to the ER?
I could call her and just check on.
No,
Okay, because I've had that as an issue.
no.
I'm sure they have strange schedules, but yeah, she did commit to it, so. Okay, thank you. And I've made a note, so we'll look into that. And next, anyone else have anything for privilege of the floor? And I have no board correspondence or announcements. So we can go into the main part but maybe we'll let Larry speak first about what it is he wanted to tell us.
Okay, so, the mental health subcommittee had a really great, roundtable with the school districts, in the county, and I wanted to thank, Jessica for her work putting it together and to really, commend all the people who were able to come. I thought we had a really great, a great discussion, identified some problems, identified things that were going well. We, I think, have a lot of work to do. But I just wanted to let the board know that work or that attempt to have a good conversation with the actual on the ground people who are doing work with students in the school districts in the county, went very well. I'll probably, with Jessica, put together a summary of what we talked about and some recommendations for next steps.
That sounds great. Thank you, Larry. Okay, the next part on the agenda is Harmony, who's going to go over the different agencies and that are funded or their funding at least flows through the county.
Sure, I have a couple other.
Sure, yeah, yeah.
Only on a post-it, so don't worry. Corinne told me to make sure I didn't put you in a coma this year and go into too much detail. So hopefully the information is organized a little bit better this year, so it will be more interesting and easier to follow. But before that, there are members from the Suicide Prevention Coalition. We're having an event planning process right now that's going to be focusing on young people and their mental health needs, and that will be sometime in the fall. We're still finalizing the date, but we're looking at October because we know for people going back to school, September is not the month to plan an event, even though that's the month for suicide prevention, where we recognize it. And it's going to be like a TED Talk kind of an event. So more to come on that. If you're interested, please reach out to Corinne and she can send you the dates. When there's meetings, there's a group that's working specifically on that, Jessica and I. So we could always need more help with that. I did want to make sure that everyone knew that the care team started with the Ithaca Police Department as well. So we have the county team with the sheriff's office, and now we have a team with the city as well. The team in the city is a little different in that the clinician works over at IPD, at the police department, and goes on rides with whatever law enforcement officer needs or whatever IPD officer needs her, because they cannot dedicate a staff member exclusively to that right now because they have some staff shortages. But because the city is small enough, it actually works out really well, because if there's a situation that comes in, it might be a different person responding. So it seems to be going very well. There are a lot of people also just going over to the jail to do check-ins with her. So that seems to be going well, and they're doing a lot of follow-up. She's seen about 20 people a week. So at some point we may want to have her come, and maybe there's a new police chief, Chief Kelly. He just started a few months ago. He knows a lot about mental health programs, having talked with him several times. So it's really nice to have somebody who's very familiar with different treatment models. He knows what an ACT team is, for instance. He knows a lot about the services. So I think he might be someone interesting to have come talk. I also wanted to let you know that our clinic is doing a peer-related program. It's a training. It's called Peer TAC. It's through Office of Mental Health. They have a lot of training on how to bring in peers in your program, and we'll be looking to bring on some peers in the clinic. We started with pros. Pros is actually transitioning to a full-time peer. We had some part-time people, and we have a full-time one that we're interviewing for and hope to fill that position soon. And then we'll start having peers in our clinic as well. The clinic's a lot bigger So it's very nice that they got to be a part of this collaborative. Every week they go and learn more about how to actually implement it in a clinic. So that will be really exciting when we can start offering those services to people. Speaking of subcommittees, the Substance Use Subcommittee on April 10th will be having Frankie Pirtle, who is a fellow from the public health side of things, who's going to present on the data that the county just released on opioid deaths and overdoses. And we're going to have all the groups that provide Narcan training and intervention in the community come and talk. And I'll probably do a little brief update if there's time about all those opioid dollars, what the legislature decided to do with them, what we're doing as the LGU, to get a comprehensive picture of here's the needs, here's some immediate things people are doing, and here's some longer programming. That there was a very robust process around how to really utilize those dollars. I think the county should be very proud of how well thought through that process was. And there was a lot of advertising and a lot of people put out proposals to be considered. There are many counties, they put out RFPs, requests for proposals, and nobody even applied. In this county, a lot of people applied. So it was really well advertised and people were very interested in it. So it's going to be sort of a comprehensive informational session on that new data. And then I think at some point, we're going to want to look at our local services plan, even though the one we did last year is for 5 years. They'll probably want us to have a small group of some sort review it and see if we want to make any changes to it and see how we're doing, if we're keeping up to task on the things we said we're going to work on. So I just put that out there as a thought topic for future. And if people have ideas about how they want to do that. It's nice it's not an annual, we got to start doing a whole big plan again, but we should look at it.
I just wondered if you could speak a little bit about the plan to use county dollars to have someone who is with one of the housing projects. It was in the Ithaca Voice, or one of the Ithaca.
Art House.
Yeah, Art House and Asteri. What's the other one's called? ASTERI. Those two houses are apartment complexes. It was I didn't recognize what grant it was. It was for like 110,000 or something, and it was only for 1 year. And they think that's why no one else applied, possibly, no human service agencies, but instead they're planning to go with that someone who's employed by those apartment complexes to help people in the complexes who are having challenges with, being appropriate or understanding what the norms are of behavior in a apartment complex. But I was kind of shocked to see that went to, that place like that.
Although they noted that apparently no nonprofits came forward. They've
Right,
been
that-
trying to find a nonprofit.
Nonprofit, yeah.
Was that the money that was going to fund a position in the county that originally Tammy Baker was in? Because I was wondering, where is that pool of money from?
I don't know. I'll take that back.
Yeah, if you
Get more
could,
information.
and give us kind of an update.
It was an OTR to fund that.
But it-
And she was there for less than 5 or 6 months, I think.
Mhm.
So, and I think right now the plan is to examine that, the title of that person and do something different.
Do you know about this particular funding though, that went for the staff members do you know, is that the same funding that was used for Tammy Baker's
I think so.
position?
Yep, that was
Okay.
an OTR.
Okay,
It was 2 years, but maybe it was 1 year, but
Yeah.
typically OTRs are every year, you do them for 3 years, and then the 4th year would be decided it's permanent. So it's typically, it would have been a 3-year thing, but it's 1 year at a time,
right.
right?
Yeah, and Larry called that article to my attention, because he had concerns as well. Just, like you said, there weren't any other choices, but it seems a little concerning to me because it's not my main concern is just that it wouldn't be helping people who are probably the most in need. They'd be people who were already coming to be housed there or are housed there. And not to say they might have been previously homeless and need the extra support, but I just worry about the people who aren't getting, any services.
Right.
So if we could talk about that or have a little
Okay.
update next month, that
Well,
would be
and the
great.
article noted that it was, the primary focus of the position was going to be the transition.
Yes.
And that might be able to provide some assistance to longer term residents who were having issues. I mean, and I haven't heard that most of the issues recently in either of those places have necessarily been new clients. I mean, or new residents. I don't know.
Oh, well, yeah. I guess I didn't note that as carefully.
But they
it
said
was
that, that
long-term.
the intent was supporting the transition.
I could see that because I've heard from people, they said a lot of times people think, oh, a person's unhoused and that's the biggest problem. And then they get housing and now all their problems are resolved, when in fact, a person may be so focused on just surviving, then when they get housing, you lose maybe your social supports that you had and the community where you were living. You may start to think about all the trauma you experienced and maybe too quiet. You've lived in an environment of chaos. And now a lot of times people, maybe if they have underlying depression, anxiety, post-traumatic stress disorder, conditions like that, substance use, it can actually really create a very vulnerable moment in their life when they finally get housing, because now you've gotten that need taken care of that absorbs so much energy. Now you start focusing on these other things in your life. And it can also be really challenging if you have friends who aren't housed and they want to come and stay in your house, right? And you have to tell them no, or you get in trouble if they move in with you. And so it's actually a very, very hard period of time, and to try and get people stabilized. I think you can look at IPD's data on where law enforcement often frequents. You'll find it is in those housing areas. So they may be looking at it, if we could provide people with more support, we could stabilize them and they don't lose that housing once they get it. That may be part of it.
Well, they're teaching the norms. I mean,
Yeah,
every community has its norms, and that
Right.
person is.
Yeah, that's what.
They may know the norms of the jungle, or whatever it is.
Right. Yeah.
And we can't assume.
I also wonder though, the person that's doing it, what kind of training, what their background's gonna be, do they understand about trauma-informed care, that sort of thing, and
good to get someone to come from there and talk about what their intent is.
I agree with what Barney is saying, and I think it's a good idea maybe to just talk about the homelessness and what's going on with that. And there is a committee now that's focused more on that. But I would, the county in public session has talked about homelessness, and if there are solutions to it. Building apartment buildings doesn't seem to be, stacking people on top of each other may not be the perfect solution. So there, the county is considering building a homeless shelter, or at least funding it. I think that decision will be made this year. And how those services are provided is the issue, right? So it's one just to have a shelter, because we're out of shelter space. Right now, there are 200 plus people in hotels right now because there's no place to put them.
yeah,
And for them to go. And I think of those, I think there were maybe 7 or 8, 9 or 10 kids of those. So I think that this is a good conversation to have. I personally believe that we should be putting a bunch of little tiny houses up. Like Second Wind Cottages did,
Right.
which I think is a great program. It's worked well for a lot of people. And I think a place to call home that's safe, you can put your stuff in there. You have to cart your stuff all around with you. But the secret really is the services you provide. And you have to understand each person is an individual and each one is different. And you've got to treat each one differently. And I'll go back to what Tammy told me when she told me she was leaving. She said, my biggest complaint is there's no accountability. That was number one. She goes, how can I possibly work with people when they know there's no accountability? So it's that simple.
Randy, how much does it cost a night to homeless? You say 200 of those a night? Or it's-
Well,
The bill more?
October 15th through April 15th, through Code Blue, the state pays for it. And I believe it's $139 a night. It's big money. Think about that. How many, of all those people that were in hotel, think of roughly 150, 160 were Code Blue. So the other ones were through DSS or some other program. But after April 15th, Code Blue goes away. Greg Bezzi is proposing that we continue to keep people in hotels and that we pay the bill, being the county. We don't know what that bill is. So that bill it could be millions of dollars, without a doubt. So so that's being discussed.
So building houses, even little houses might be more cost effective over the long run.
Yeah, it would be. Yeah, without a doubt. I mean, you can buy a home, and have it delivered for $15,000. I mean, they'll deliver it, it's got heat in it, so, I mean, and there's many people doing that all over the country, doing those types of things.
Larry,
You gotta have a plan, you can't just build it and just hope that people are gonna be healthy. You've gotta have a plan to help them. And you have to understand that there are different categories of people. There's the people who are, major drug users, there's people who have, maybe they use drugs because of some other reason, and there's probably 18 layers of people there. But we need to figure that out.
People
And I
that
think
don't want
this
to
is
stay
where
there
this
365 days a year.
should come to play.
Larry, you had something to say?
Yeah, not to take up more time because I know we want to get to the overview of the programs, but I think there are two issues. Well, actually, three issues. One, that there were no nonprofit, or that this was the only proposal for what to do with the money. The other is, I think we want to look at, I think one of the outcomes will be whether IPD or other, or, the outreach program or whatever other programs, how often after this person is hired, how often, whether the staff time is reduced, responding to crises. And the third thing is, when I read the article, there seemed to be a great deal of nervousness about, underlying, nobody said, we're nervous, but it seemed to me that there was a lot of unspoken worry about whether this would actually work and whether it was the best use of the money. So I think it will be important to look at whether the response rate from IPD and other entities reduces, because if you look at it, part of what started this entire reevaluation of what we're doing for people in the encampment and people who live at Art House and other places is complaints by, or supposed complaints by people who live near and around or have businesses near and around where homeless people are, or people at risk for homelessness are. And if that doesn't reduce, if the use of that money doesn't reduce the stress for people living around the areas, I think we need to reconsider what we're doing with that money, because it's a significant amount of money in this context.
Oh, sorry. Go ahead. Were you done, Larry? I'm sorry.
Yeah.
I was just going to say it is a lot of money, and it's buildings that had huge tax abatements. So it almost makes me think you could afford to have your own manager that does this kind of work. It's just my thought, but I think they should also look at the longevity of the people that are able to stay as tenants. That would be another indicator of how well it's going, if they're able to stay, and also the amount of money put into damages to apartments, because that's been a huge cost in several locations as I understand it. So those are just a couple other areas where they could keep some sort of data so that we could see how successful it was. But we can talk about it more next time, since Harmony's got a lot of information for us tonight. A lot of good information.
Yeah, be good.
So this year, we decided to break the report down into topic areas. So on the first page, you'll see all of the funded agencies. I did do a PowerPoint because, I don't know, this seemed like something easier just to read it since it's a report. And I'm not gonna read it all to you. Aren't you happy? And then there's a table of contents for you to look at. There you can see we broke things down by adult recreational services, children's services, employment, housing and social supports, mental health and substance use services. So those are all of our categories. And it probably won't take, I'm hoping we'll get through this and it won't take too much time. This is our one thing on the agenda. It's absolutely glorious night. So we'll see what happens. The one interesting thing about adult recreational services is they are provided by the Ithaca Youth Bureau. So when people say, oh, there's dollars that go to the Ithaca Youth Bureau, yes, but they provide support services for adults, specifically with mental disabilities. This pot of money, $130,614. You'll notice that their outcomes are pretty close to where they were last year. They served over 2,000 more services than they anticipated, even though their number is smaller than they projected serving 150. They served 121. If you recall, last year they served more than they had expected. So we increased that number and they were kind of trying to get it back to normal. One of the highlights from them is really that there just needs to be more of these services available to adults. So they basically have to limit the amount of services, limit the amount of recreational opportunities people have available to them so that everyone gets something. So, and they've said that now for a couple of years. And I think that their program's growth is because it's probably an amazing program. And it's also because other programs don't have the staffing available to them to provide some of these services. So people might have gotten them in other ways before, but because there's such a staff shortage, they tend to be the ones who are picking up, providing recreation supports for people, and they do a lot of the transportation too. So that's adult recreational. Any questions, thoughts on that one?
I just had where it says how better off. I didn't understand what that meant after it says.
They have a scoring
Percent
system.
or
that they-
7 or
Yeah, that
lower.
they developed where they really score how people are doing in the program based on all this. They do a lot of skills work and support for them, and they have their own internal scoring mechanism. So what they want is to see a 7 or lower on this assessment scale, and that's a sign that people are developing the skills. So they score them when they begin, and then they score them over time while they're in the program.
Okay. Thank you.
So the next category is children's services. The first one is adult alcohol and drug council, and they have there are two agencies that were providing OASIS prevention services, and one was alcohol and drug council that has closed at this time, and they offered primary prevention services with the Too Good for Drugs curriculum, and this year they were able to provide it to more students. They offered it in a school district that then wanted to have more of the service provided. So they thought they were going to serve 30 kids. They served 80. And you can see from there, all of these evidence-based curriculums that are through the OASIS have pre and post test measures and have been shown to be effective. So they have pretty good ways to measure the effectiveness of them because they've all been designed professionally. And OASIS keeps a list of programs you're allowed to use, and they call them evidence-based on the OASIS list. Early intervention is they use the Teen Intervene model. They were using that in three school districts, New Roos, Ithaca High School, and LACS. And Teen Intervene is, and the reason I'm kind of going in a little depth with you, because these are the services we just lost through the closure of Alcohol and Drug Council. So I want you to just have an awareness of what services were just lost. Teen Intervene is a program that provides one-on-one support to a young person who is sort of dabbling with substances. So they've already started using, and the program can be 3 one-hour sessions or 6 half-hour sessions and can fit into a school schedule. It's been shown to be very effective with kids who are just sort of starting out using, but they haven't really developed an addiction problem or anything like that. Maybe they're using for social reasons, to fit in, whatever their reasons are, and you explore that with them in these sessions. But the other thing that's really helpful with the model is if it's a child who is developing addiction, who really should be moving into treatment, they can identify that, and then what they would do is then help get that child connected with the service, the outpatient clinic services that they provided. So you can see in both ways, we lost that. Is there a question?
I mean,
Oh, I thought you were pointing.
briefly, how are we going to cover this?
So what's going to happen is Oasis has reached out to us. So they want us to, the county, to put them up for an RFP, all the services at some point. And there's still some clarity that we have to get on that process. But we've been working on the prevention RFP already. I talked with both Stacy Cangelosi, who was the previous executive director at ADC, and she ran the prevention programs.
20 years.
And I also talked with our BOCES prevention provider about where are the gaps, what are the needs, what would, if we could redesign, because one of the things is you don't ever get much of a chance to redesign unless you have a tragedy and you lose the service, right? So how do we make the best of this and design a program? And basically the idea being BOCES, our other prevention provider, provides services in school districts. So we're really looking for a provider that can do some in-home services. They would still do that Teen Intervene service. And they would still do, there's another one, a non-evidence-based program that they do at Cuba Medical, where they go and talk with all the kids that are in the hospital there. And it's just a one-time intervention to make people aware of services that are available. So keep those components, but instead of doing a lot of school-based work, look at doing more home and community-based work for kids who have higher needs. So that was the feedback I got from both Stacy and Brandy, who runs the TST program. So you see on the next page, on page 6, the TST prevention services numbers there. You can see the number of students receiving ongoing interventions. They thought they were going to serve 75, they served 177, and that's because they filled the position. So, it really shows the importance of making sure you have the staffing you need. Brandy's also in charge of doing the survey of all the students, the needs and attitudes around substances. And it's a really helpful survey. The substance use subcommittee, I think Brandy is coming, not this month, but in May, and she's going to go into a lot of detail on that report that they just did. And they got every school except for one school district, so that's really good. That gives a very nice snapshot. The report they use in Tompkins County is different than what we use in most counties because it also includes some questions about mental health for children. So how often do you feel depressed? How many, those kinds of questions. Have you ever thought of suicide? They have some other questions that are embedded in the survey, so we get a broader understanding of how children are faring, what they're thinking about. The next program, I didn't want to go through all of them, but I wanted to talk about the Mental Health Association. So the Mental Health Association has the Family Peer Support Services. That's on the bottom of page 7. And when Josephine Gibson came last year, she's the executive director of Mental Health Association. She mentioned that, and I just want you to have a heads up on this. She mentioned that they have one program that they're not sure if they can continue to provide because they really struggle to find families who want that program. So it's that Family Peer Support Program. You'll see that there were they projected 40, they had 68 that participated. But then when you look at the units of service, like the hours of time they spent with a family, it was a lot less than they anticipated. And that's because what Josephine is saying is that this program is not necessarily what people really want. It's tied into, on page 8, the respite services. So the only way you can access the respite services they have is if you're also in the parent education component of the family peer support services. And most parents really just want respite. They want respite plus a program for their child. And unfortunately, they used to have a big program like that, but it wasn't, it didn't meet all the criteria that OMH had set for a respite program, so they had to redesign it to meet the criteria. But really, families just need a break sometimes. And it's one of the services we're lacking is just respite, whether it's for an hour or two. No particular program that you have to participate in. If you have a child with special needs, you're working really closely with a child and it's exhausting and you just need 2 hours to go get your groceries, good enough. That kind of program. And then we don't have any local respite for any overnight respite. People have to go to Elmira area or they have to go to Binghamton area to get respite services, which is really a significant gap in our service system right now.
When did that occur? Because they used to have respite, not on demand, but without any buy one, get one free. You didn't have to join the club to get respite.
Yeah, OMH told them that the model,
OMH,
it's OMH's model of what's an approved use of the funds. It didn't match the approved use. So they used to have it at the Y. And years ago, when I had a private practice for children, I sent all my clients to there. It was a great program because people just sometimes need a break, right? And you've got someone practicing social skills with your child, right? There's a lot of this learning that's happening that's very positive. You were connecting them with a Y, with all sports and all the good things that they have going on there. But it didn't fit the description for these dollars. So that is the problem. We'll see what happens. They want to give one more this year, the last try at it. So that maybe, something I'll be talking with OMH about. Our regional person, Jean Sadawi, is our regional person to talk about what can we do? Because these are their dollars, they're state pass-through dollars. They really have final say about how the dollars are spent, but just alert them that this is going to be potentially an issue and let's start planning now and see what the state is thinking might make sense. And I can certainly advocate that these are where our needs are. I did also, sorry, got to make you go back, under Racker. I just want you to read at some point when you have more time. I know you didn't get this report with a lot of time. But Sally Manning, who's come and presented to you before, our children's SPOA coordinator, single point of access. So basically, Sally's the person people call when they don't know what to do for a child. They really need a lot of services. And her last paragraph here, she talks a lot about different things she was doing around youth. But her last paragraph is just to make clear. As reported every quarter, families continue to experience wait lists for higher levels of community-based care, and there continues to be wait lists for some DSS contracted services in the community as well. There are very limited services and support for youth under the age of 10, especially respite and hospitalization. We continue to lack additional intensive services that are dependent on Medicaid funding. And then additionally, many health home care management agencies are struggling to maintain staff. And new regulations and new rates have led to some agencies closing. So there are a number of agencies that provide care management services. One of them was at William George, and they decided to stop doing it because some of the rate changes. They didn't see it as something that was viable for them anymore. And it does seem like these jobs, it's hard to keep people staffed in those positions. And they're basically like the glue services, right? Care managers, you're glued to all the services you might need. So our children's system is really struggling at every level. They created, what's called CFTSS. Don't ask me what it stands for anymore, because I used to know, now I can't tell you. We're probably serving 10 kids in the county. And we have almost 200 children, 120 children getting care management. I asked Sally today to make sure I gave you, about 120 children are getting care management services. And sometimes they may need that for a really long time because they have really intensive needs. Sometimes they need it for linkages for a short period of time and then they stop. But so it's really important that those care managers stay in those jobs long enough that they understand all of the services available so they can really guide parents. But I think it's really stressful to be in that job if all the programs you want to refer parents to have a long wait list. Because then you're trying to juggle and create and, you can't just do your job, right? So I think it probably feeds into why the staff turnover in those kinds of jobs, because there are definitely people who care deeply about children, do a lot of times above and beyond what their job is. And it's tough. So we don't have those lower kind of tier out of home, in-home, lower tier levels of programming. And we're struggling at the higher levels, but we did get our children. It's an ACT team. We do have one child successfully in. I think we have 2 more children getting referred. We have a few more programs that are out for requests for proposals by OMH that would provide intensive support to children. And there was a new program they just announced, and I know of one agency that is planning on applying, and it would be a support program for children who keep going to the ED. Maybe you don't get it admitted, or maybe they need a lot of support at discharge from an ED. So we'll see what happens with that program. Don't ask me the name of it. Everything's got an initial. I can't keep up with all the initials. It just came out last week and I saw it and I immediately emailed someone and said, are you guys thinking about doing this? Because I'm thinking maybe you should be thinking about doing this. Yes. I'll have to go rack my brain and go, now what's the name of that program? Which there's so much going on with OMH releasing money right now. Because the governor really put a lot in the state budget for mental health services. One of the challenges now that agencies are facing is they've been awarded, but there's no contract, right? And you can't start until you have the contract, except maybe you thought you could. And then maybe you hired someone and now you don't have the money because you don't have a contract. So that's becoming a bigger problem across the state, that OMH is trying to keep up with the rapid pace of the proposals that are going out. And then once they award, getting the contract out to people so they can really start those services. So that's becoming more and more of a struggle. But also they probably would have had to hire, I don't know how many more people at OMH to keep up, because it's like every other week there's another thing going out that they're reviewing. So, I mean, it's really good to have all this money flowing, but got to be able to actually get it out there.
Can I ask a question about Racker? For Turning Point, I see projected was 75 students, actual was 54. And I know they noted staffing shortages. Do you have a sense, is that the primary reason? Because I know we've got many kids on the Turning Point wait list.
It's staffing for the clinician staff positions, it's staffing at the school that they couldn't take people in, is what they told me before, that they were having challenges in hiring people at the school itself. So they were working with OMH to find out if they could go into different class settings and provide the supports there, because it is not a problem with the clinical staff. Right. So they're working with OMH to try and get permission to do that. They also noted that children are much more violent. And it doesn't match well when you're low staff and you're seeing like an increase and some of the aggression. And I don't know if that might have something to do with, there's programs through Office of Children and Family Support, OCFS, that mostly are connected with DSS. If they've had some closures with some of those services, and kids that have maybe more behavioral problems are typically Office of Mental Health programs have kids with some behavioral problems, but not to the level that children that go through OCFS programs have. I used to work in OCFS programs mostly. I did some OMH programs too, but you try and keep the population separate from each other, because Some kids are more like internalizers, and it's all going inside of them, and some kids are like externalizers. And it's not good to mix them sometimes. They can do harm to each other that way. So, or it could just be kids didn't have a lot of services for a couple of years following COVID. So, but it's definitely a problem that they're seeing with kids who need higher care in their educational settings with a Turning Point program.
As we collect data on staff shortages, is record?
Well, that's what we're gonna be working on. We have to finalize our form and our process, and we did have that meeting with a lady from OMH who is an expert, and I think she kind of has a very big vision for us, and I'm thinking we're gonna have to take it down a few notches, because I'm like, no, this can't be our major life's work. We just need to gather some useful data to demonstrate, because you can see it right here, right? But it doesn't help. It's not in a format where we can quantify exactly how many children did get a Turning Point level of care. And it's not even because of a clinician shortage. So, but it's the staffing shortage issue in the school. I did just want to point out there are many positives, so I'm hoping I don't be a downer all night, but one of the things we were able to do with Family and Children's Crisis Intervention Outreach Services, you'll see that on page 9. They provide a 0 to 5 program, and their numbers here look a little off on their 0 to 5 program, but they did just hire a clinic director. They had a vacancy for a period of time, yet again, right? Who's revamping and redesigning the program, and Family and Children's is coming, I believe, next month to talk with you, so can talk further about their programs. But their crisis intervention outreach program is designed, we paired it with the Open Doors Adolescent Homelessness Services that's funded through Tompkins County Youth Services, so that they were separate pots of money, right, that Youth Services had from the county, and then we had these OMH crisis services. So we paired the crisis services for the homeless or kids that were at risk of being homeless. So you'll see some pretty interesting things there. Number of youth served, 32, number of counseling sessions, 77. So these are brief, crisis oriented. Most kids got somewhere around 2-3 sessions, and 18 of the 32 were able to remain in the home. And then there were 4 times they were able to divert a child from having to go to the emergency department, which anytime you can do that is a good news, right? And 11 children had improvements in 2 or more protective factors. So I think that is a really wonderful crisis support program for kids who are at risk of homelessness, and us being able to link it together like that. It's like more of that coordination of services of what we need to do.
Can I ask a question about 0 to 5?
About which ones?
0 to 5.
Uh-huh.
Just in terms of what level of oversight or feedback sharing we have. I saw that 0 to 5 is trying to hire a new program lead. And I believe the salary was listed at $50,000 for a master's level clinician, which is, in my opinion, a really low salary for someone to be orchestrating this program. Obviously, OMH doesn't totally fund this program, but I don't know, it seems concerning to me about how they're gonna find someone who can stay and like build a program long-term while offering a salary that's below what providers at that level are getting in other local organizations.
I think it'll be good when we have them come and talk to express that concern. I mean, it's really hard because you have a lot of other things you're paying for in the program, and these amounts of money go up just a small amount every year. And we all know the cost of doing everything has gone up a lot more than these sort of traditional pass-through dollar programs. So that may be a good thing to talk about, like how are they figuring out how to balance that, right? And these amounts don't go up very much at all. Uh-huh.
Just for my own education, so are all these programs state funded primarily?
Some of them have, have both county and state, and some are just state pass-through dollars.
Okay.
So now
I know you.
now they don't do that really much anymore. Now the state just does an RFP separately with an agency. But they still have these old contracts that go through the local government unit. And they really feel like they're stabilizing because a lot of times agencies have them for many, many years. They don't want you to put them up for an RFP. They want to keep the nonprofit sector stable with them. So there are not a lot of them, and sometimes there's matched dollars from the legislature that's probably been there for a long time too.
That's probably.
Yeah.
So to your point, Jessica, yeah, I learned something new. I mean, 3 years I've spent third year in the legislature, and I'm still trying to figure out how the money moves, right? So, because there's a lot of it going all sorts of directions. But I think that a committee like this, I think their role, this is just one legislature's opinion, they should be looking at what you just commented on and say, maybe the legislature should be funding some of this to get the salary up to where it needs to be so that we can hire people. Just my thought.
And you get a big bang for your buck, right?
Right.
Because you're not spending a lot of money on it because you're putting so that's why like with the youth service, like combining that other program, right? Like it's just doing smarter things with your money.
Yep.
Yeah.
And the county has money, your money.
It's in that
Mm.
vault.
It's in a vault.
Right.
Yeah. The paper. Electronic vault, right?
Yeah. Getting a little interesting.
So under employment services, you'll see there's challenge and their programs are doing really well. The one program you'll see both Challenge and Catholic Charities on page 11 is this ongoing integrated employment services. So it's Boise and Jan's like, yes. They get referrals through Access VR, and Access VR is still trying to get its feet underneath it from not necessarily having space in the county during COVID, and they need more referrals from that. So I did have a meeting with Access VR and OMH and our two providers, Catholic Charities and Challenge, to try and hammer out why aren't we getting the referrals like they're getting in other counties? Because other counties are not having this problem with their OASI slots. Every county, the state has some magical formula. I don't know how they pick how many slots you get. It's one of the few programs that's based on a slot. So you get so much money for each slot that you fill with a program, but you can't fill it unless you get people that are referred to you from Access VR. So they're trying to find some ways to get more referrals so that we can get our numbers up. But it sounds like we're going to we regroup again and hear how they're doing at the state level. So you look at Catholic Charities and say, well, you didn't provide any services. Well, we're trying to fix a bottleneck somewhere in our system for these other services that have to refer to them. So that's really not on Catholic Charities. They tried, they did outreach and all this sort of things, but until they get these referrals, it's a problem. Now Challenge was doing the service earlier, but wasn't really seeing a lot of people. So my assumption was, well, maybe they need more choice. So let's get another provider, and Catholic Charities does these services in 2 other counties and has no problems providing the services. So it's just getting that strengthened again, and hopefully this next year we'll see that. So when you look through the report, you might say, well, that's why is that off? Why are the numbers so much lower there? They projected 32 at Challenge. That's how many slots they have. And then there's an additional 10 that Catholic Charity has, and Catholic Charity served none and Challenge served 15. One program that's going really well.
I think Jessica had a.
Oh, who's the Jessica up here?
I don't know, are these programs that like committees for special education, as they're thinking about people transitioning out of the school system, can refer to, or is it you have to go you have to access VR through BOCES to get there?
It's called OMH Extended Services. So once somebody goes through Access VR, and they get a job and they're what's called stabilized, so they're 90 days, and at least that's what it used to be, in employment. Then they go into extended services, and those are all siloed. They're either OPWDD, OMH, or access pays for people who are have a physical disability. So it has to start with them getting a referral, whoever gets it, from access, and then get them employed, get them stabilized, and then when they go into extended services, that's what we're talking about for OMH.
How do people get to access?
They, they go to an access counselor, and there's our regional one is up at the BOCES, and they spend a certain amount of time there. So I don't think it's so much youth. I think it might be more, I'm just guessing because they
Thinking
are
as
up
youth
there,
age
but I
out.
wonder if it's
Yes.
the population of people that have a mental health diagnosis and are adults and just aren't coming to access for help with that.
They did just do a presentation for our pros and clinic staff as a part of their plan to try and get the word out, because we really, people that want support with employment, there are a lot of wonderful programs out there. So pros is one of them, but there are all these other wonderful programs too, so people can really have a choice and find the program that works best for them. One of the programs is the transitional employment services that, we had some leeway in the design, so when we, were looking at them, it's really, I would call it the low threshold employment program. It's really designed for a person, maybe they're transitioning out of jail, maybe they've been in a hospital for a long period of time, they don't really have a lot of work history, and they're kind of still just getting their feet under them, so they're not fully stable. So a lot of the programs require you're gonna work this many hours, you're gonna do this many things, right? And so if or you have a crisis and you have a relapse of some sort, a challenge of some sort, then you could potentially lose your employment program. So this transitional employment services program that Challenge has is really nice because you can help people, maybe they're in the wellness and recovery court. Maybe they're really struggling, but they can start. And there's no rules about you have to do X, Y, and Z. So you can really make it very flexible and designed to where that person is at. Then they can transition into the other programs as they go that have more rules and more expectations. But if they have a crisis and they need to step back a little bit, they can do that as well. So it's really nice to have that. And if you staff it with the same people doing the more than one program, the person doesn't even have to have a sense of that much, like maybe they don't work as many hours or something, but they don't lose their staff member that's supporting them if they have a hard time. So that's I think a really useful program for people to think about. And they were full there, but they did have some openings at the beginning of the year. So they have a lot of different ones to choose from, so that makes it nice, a challenge. Housing services. I try to write notes, so I would not have to read everything to you. So we have 3 programs: Unity House, Lakeview, and St. John's Community Services. I just wanted to point out a couple things. Unity House has our crisis respite program. It's on page 12. It's the second one under Unity House. And while we still need to get our utilization number up, the goal is 90% utilized, or at 68%. People are staying there on an average of 52 days. They served 6 people. We had hoped we projected 8. But 81% of them after that program, they go into that program, they help them find a stable housing, a permanent housing, and 81% have remained permanently housed for at least 6 months after being in that respite program. So it's a respite, but it's longer than what you might think of respite as a week long. Right? But the average time they're there is about 52 days. And the fourth quarter, that dropped down to 38 days. And all of them were successfully discharged. So as we hopefully get more housing programs going, people don't need to stay in this program as long, and they are probably struggling with mental health needs. They may not even be interested in getting treatment yet. So it's a lot of work to help support them in getting into housing. But those numbers have actually improved over the last couple of years, and I think they'll get better, and just wanted to highlight that program. Also wanted to point out, everybody knows there's a wait list for programs, and the health care the supportive housing on page 13 by Lakeview. They say at the end of theirs, at the time they wrote this summary for the year, there were 28 people on their wait list for that one program. And they served 47 people. So, and that gives you a little sense. Sometimes adult SPO meetings are mostly about housing for people. And there's a wait list for every housing kind of program we have. And you can see that there's a lot of people that don't have housing when you look at the numbers for St. John's on the bottom of the page 13. Unduplicated number of people served that were homeless. It was projected at 700, and they actually served 1,189. And then their Friendship Center people, that's a duplicate number for the Friendship Center, because people come multiple times and they don't really track that very well, but it shows that people are going there and getting benefit from being there. You see how much that utilization is. And then it's just numbers of meals they're serving through people. So, and that again is a duplicate number. And people get hungry the next day. So, but you just see how much higher it was than they anticipated. And that is a small amount of money. There used to be more dollars that passed through our LGU, but the state carved them back out and put them into a different category. So they get more than that, but not through us anymore. There is a lot of housing coming. Rehabilitation Support Services is working on, they were approved for 8 treatment apartment program beds. So those are called TAP. They're in the process of working through all the steps they have to do with OMH. So that will be nice to get. We do have some other ESHI housing that should be coming, and Rehabilitation Support Services has also received an award for supportive housing, single room occupancy, SRO housing. I don't know how many slots it is. I just found their congratulations letter and I couldn't find, it didn't say in there how many slots, but they got it. They're pending their contract. It told you how fast those are happening. So there's more housing that's coming, and there's more support services. So we also have a safe option support team, or SOS team, coming to Catholic Charities, right? We learned about that, I think, a few months ago. So there are new programs that are coming, and along with that safe option support, the SOS team, they're an intensive case management. They're going to be partnering with some housing for people who have mental health, substance use, or developmental disabilities. So there's housing attached to it, and all the people that live in that housing will need to have an SOS or be in the ACT program, the sort of community treatment program. So they'll have some mental health services wrapped around them. So those are all coming from the state. Let's see. Mental health services. There's the Elder Mobile Mental Health Program that Family and Children's operates. And we talked last year in our local services plan, we're going to have to look more at what are the service needs for elderly people, because we focus a lot on children. You see all the service we just talked about with children, but we also know many people are aging in place. It's very hard for a person who has been in some of this housing, who may actually benefit from going to a nursing home or assisted living program or something like that. And it's very, very hard for them to move into other programming when people see their mental health needs. So that can be a real challenge as we see some of the housing that we've had, like really, some of it probably could be opened up for other people, and other people that need really more support than they're getting. They might be developing dementia or having a lot of medical problems and so forth. And it's really hard to get them into other places to live and just all the clinical needs. So having a mobile unit that can support elderly people is really wonderful. So hopefully you can ask some questions about that program next time. And then you see Mental Health Association, they had some challenges with the program that was peer and respite services, the family peer program, but you can see their numbers here are pretty significant. Their peer support and adult advocacy services on the bottom middle of page 14. They projected 200 people and they served 628. And just the number of people that they projected 80% would in a survey say they're better off 88%. And just the number of units of service is so much higher. And they did get an over target request right above that. Their psychosocial club, they get money from the state to help with, running that program, their psychosocial club. Now the peer outreach center, the county did an over target request for 2 years for 86,000 to help them. They're on the commons to help pay for that new space and cover that, making it more accessible to people. And you can see all the services here that people are eligible to get there. And also their program that's county funded that provides supports to people at the jail, people at Cuba Medical Center, the Wellness and Recovery Court. They're serving 440 people and the county's giving them $27,702 for it. So you can see like just some of they're doing some pretty incredible things there and people are finding it useful. 92% of the people say they're better off because of it. And they're doing a new trauma program now, a day reporting for probation. I mean, these are all the things that really can make a difference for people. And suicide prevention crisis services, we had Tiffany Bloss, executive director, talk to us previously. I got to tell you, she is one phenomenal person and we are super lucky. When she started here, we were just in the middle of transitioning to 988. The state had really taken away all the programs that they were working on, except for their own. Well, she's now spread to 17 counties providing 988 services. She's established a warm line for people. She's working on the text line and does just amazing things. Those numbers there, those are just our county's numbers. That's just us alone. And she has really beautiful data you can look at.
Speaking of numbers, Harmony, I like the way you wrote this up and have the OMH numbers listed as well as some of the county dollars listed. For the sake of some of the newer folks in our board, that's not their whole budget. That's just what they get from OMH.
Right,
through
right.
us. So to see a whole budget, because a lot of these, they're getting millions of dollars. In
Other places, yeah. But some of them, that's it. That's
Yeah.
what they're paying. And they got some pretty incredible outcomes for a small amount of money. But yeah, suicide prevention services has, contracts with all these other counties to provide those services. And they do some other things, like you have to figure out how you're gonna be fiscally, responsible and that sort of thing. But they're now 24/7. They have enough staff that can provide the 24/7 coverage here.
I just wondered again, where it says how better off, there's just a percentage that it just.
I probably just missed that one. Darn it.
Okay.
You know how many times I proofed this darn thing? How many times we proofed this crayon? We'll find it for you.
That's okay. It's not a big deal. I just.
Well, whatever it was 100%. I got the.
Well, with serving that many, that makes sense.
Yeah, yeah. And they do a lot of education programs there too. I think hopefully helpful to just know what people are doing. And then substance use services, again, you'll see Alcohol and Drug Council. This was an eye opener for me because in their last year of operations in 2023, right? They served 623 people. Now, what you'll notice is that the numbers of visits was still, when they projected 350 people at 10,500 visits, they served 623 people, but only did 8,189 visits. And that's sort of the trend, right? And substance use outpatient services. There's been a big shift. There used to be a push, like people were mandated into services. There's been a really big shift and push to get people medications and to get people stabilized and stay alive today. And that is all very, very good and important work. One of I think the unintended consequences of that is some of the outpatient programs weren't really ready to know or have the resources to maybe engage in ways that could support outpatient work. A lot of people may just want less service. So I think the field is sort of under a state of change right now. And we are really just seeing that in these numbers, and it really creates problems for programs that most of their funding is coming from billable services. Right, so.
The two agencies in town, roughly say 70% were from mandated types of clients from either DSS or drug court programs, a variety of different things that they would have to seek treatment. And that's gotten a lot less. It's been a lot, in some cases, not having to go or less amount of time to go.
Right. So as Oasis has moved pretty quickly, I think from a more coercive kind of a thought process, like mandating services to people, to this, what would you want? What works for you? And a more engaging approach. It has been a struggle for outpatient clinics in particular to know how to manage that change. Because Oasis probably thought they gave them a lot of time to transition, but I don't know if there was. We also had COVID in the middle of this, right? So you're trying to figure out how to engage people when you can't see them. So that made it really tough. So you can kind of see in both numbers at the CARS, their outpatient program, the same kind of thing, but there's still a significant number of people who are getting services from them.
Are these billable services?
Yes, that's why it's so bad for so it's destabilizing, right? Is that these are all billable services. So when you predict you're going to see this many people and you're almost seeing almost double that, and your services are less than what you would have served, like that really impacts your budget if you're an outpatient program.
Yeah, I was also wondering about this year, like where that funding would go, but if it's billable, it's not gonna go anyplace.
Right.
Well, the billable is just part of their budget, which, is a
Right.
small part of their budget comparatively speaking. And with the onset of allowing diagnosis of harm reduction, the state, smart or not, pays a lesser amount for that diagnosis than a dependency diagnosis. So, another reason why the agencies or the alcohol council got in trouble was they couldn't bill the maximum like they used to.
Right. Yeah, so I think you see a lot of agencies like Alcohol and Drug Council will be struggling. And the next, it's been a big change in how services are delivered for people. And so I think just when you can look at these numbers kind of through that lens and see, and see how that would be destabilizing to someone's finances. Their detox information is there. This was the second year of an OTR for 200,000. So the first year was 250, then it was 200,000, and then the third year this year was 150,000. And that was to help support in the staffing and starting up those services. Now, when all of that happened, right, in the original OTR, I don't think anyone had the idea of the costs of hiring clinical staff at that time. Because every year it's just gotten worse and worse, and the shortage has gotten worse. And that really created a problem, because if you build a program that is billable, you need to have the staff to start to bring in the people to start billing the services, right? That was a big portion of the model's design. So they had just started really getting those services going in 2023. And then cars is here. You'll see it's also their outpatient has seen a reduction in number of services they anticipated, very similar. They served actually they expected 500 people, they served 248. And they provided about half of the services that they had projected. So their numbers kind of line up with the amount served. Now, one of the things that's happened with CARS is that they are in a partnership with Cayuga Health Services. And one of the things they did, you'll see on their day treatment, the numbers of people served you're like, wow, they projected 400, they served 174. So some of that might have been, I don't know where we were with COVID and having to be at 50% staffing. They also had a lot of staffing challenges for a while, and the partnership with the hospital has helped them stabilize, and they report that they really did an overhaul of their clinical model for the program and really took that time when they had fewer staff so they could have fewer patients to really look at their model and improve the quality of the services that they were delivering. And they've been doing better hiring staff with that partnership. Although it's still challenging because it's not quite as competitive, maybe some of the medical. There's always someone that does, it seems, that will pay just a few dollars more. Right? So the salaries are constantly getting escalated like that because there's such a shortage, and you have to have medical staff if you're going to run a program like that. So the new one on here, I think for you, is the REACH project. They had an over target request. It did not come through our committee. So I did talk with them about next time if they make an OTR to make sure it comes through our committee for your review first. But I love their little logo. They have $87,500. So 2023 was the first year. They're now in their second year, and was to create a behavioral outreach team. And you can see this is like a light touch. There's a lot of people being served, but it's not a lot of service when you look at the number of treatment. And that's not just for that team. That's all of their numbers composited. They had a hard time like figuring out how to break down their numbers. So that is really to help people oftentimes who are homeless out in the community and get connected with services. They have an outreach worker, a nurse, and a physician assistant prescriber who uses telehealth to reach people. So that team in particular is within that debt. So what I do, I haven't looked, no one fell asleep, no one fell out, so.
Super helpful. All of the formatting of it, the condensing of it.
We're getting better every year, right? We had a lot of sleepless nights on this.
I like the format a lot.
Yeah.
Very good.
It was better than last year.
Yeah.
Yeah, breaking it down by type, right, is helpful.
Larry had a question.
So actually I have a comment and then a question. One is just, these are the contracts and the monies that come through the county or that we oversee. But it's not the entire system that we oversee. So just keep that in mind, that this is a slice of all our responsibilities to make sure things are functioning. So I had a question about substance use services, which is the substance use subcommittee, how broad is the discussion? How many people, how many stakeholders are involved in what to do now that the Alcoholism Council has stopped providing services? Because obviously the needs are not gonna go away. Even if there's a new model for providing particular services, there's still those needs. So I'm wondering how broad and diverse is the number of stakeholders talking about what to do next?
I think, Larry, at this point, we're still in the beginning stages and the focus is really talking with Oasis about what we should be doing. Oasis has recommended that we put them up for a request for proposals. But so that whole discussion on prevention services, really the prevention providers had a pretty good idea. They also have their own committee that meets that talks about what the needs are, and Brandy is a part of that. So just trying to get that input and also doing it in a very as timely a way as possible. You know, Oasis wants us to try and figure out how to do that pretty quickly, but they also have their processes that take a lot of time. They have to get approval for us to even write a request for proposal. And then it has to go through the legislative process. So I think it's mostly going to and the language in the RFP has to be approved by Oasis. They've sent us some templates, so it's pretty much the process is the state is going to tell us how a lot of this needs to look. I know that they really want to see the detox program up and running, and I don't know if anyone would disagree with that. I think the services, they're going to want to see pretty much the same things we want to see.
But there's plans for that on cars in the hospital, well, at least the hospital, it's taking some responsibility in moving that forward and staffing that.
For CARS's residential programs, not the detox programs through Alcohol and Drug Council.
Not the one on Trip Hammer?
No.
I thought that was the
No,
plan for them to
Yeah,
cover that.
no, I think it will have to go
That's just
for an
all.
RFP.
Okay. Okay.
Because the
Well,
state
it
will
just-
want to see that it went through a regular proposal process.
I just, I understand that there's technical and, template stuff that we need to, words we need to use in the RFP, but it also seems to me that the more people who are involved, if not in getting the RFPs out, but in stabilizing the whole situation, the better, because, the need is acute for.
It is, and Frank came to our substance use subcommittee last month and spoke with people to really get the feedback from the substance use subcommittee. I think you were there, right, too? About just people's feedback about the loss and what in particular were the losses to them and what role Alcohol and Drug Council has played in our community. And it was a hard meeting. It was a hard meeting. It's a big loss. So I think those opportunities as they present to get people's feedback, and then also trying to, hear what people are saying the needs are and see what pieces we can add to the RFP, because that's important. Like if there's a certain flavor of program, and then also making sure we write it just the way Oasis wants it. So we get it approved, because they can be slow. But yeah, so it is good to get people's feedback and hear from them. And I've reached out to a lot of people to say
Great.
what was the unique thing about this agency? Just to hear one-on-one from people, because I think sometimes you're in a group, you hear different things, and then one-on-one people tell you other things to try and understand the role they played. They were here for a long time.
It's late 70s.
Yeah.
Oh, and I had another question related to that. How will decisions about the actual physical space taken up on the 5th floor be made?
I don't have the answer to that yet, Larry.
Oh, what? What was this?
Up here, the 5th floor?
Oh, I see, yeah.
Oh, who's supposed to go on a
The
tour?
facilities committee was looking at giving a tour of buildings, and they talked about that.
Oh, okay.
There's no schedule. But they-
Yeah, I think they're still working on getting things cleared out. Their board is trying to we're still at that step right now. Yeah.
Because
Office.
it is a large
Assessor's
space to
office.
have it is a large
don't even
space to have
They
empty in
need-
the building.
Anyway.
Right, no rent coming.
There are a lot of
They need mental
employees, like 40 employees. Are they all unemployed now or?
Other agencies were able to do like rapid interviews and things like that. Like, there are a lot of vacancies in other places, so I know that CARS offered people that as an opportunity. So there were, and I don't know if there were other agencies that also offered to do that, but since CARS is the most local one,
Right.
I know they did that to try and help get people employment as quickly as possible, because they didn't have a lot of notice.
Yeah, I heard that too, but I don't know if all 40 of them went to cars or wherever.
And maybe.
I think they had some
Safety.
staff shortages as well, so I'm not sure what their total number of employees was at the time of the closure. But it is you know, it's a whole floor, it's a big space. I think we're still trying to work with their board to help them get their items all moved out and that sort of thing right now and figure out what to do with it.
Where are the patient records? Who's responsible for maintaining the confidentiality and stuff like that?
Their board is working on all of that. So I've talked with them about that.
Will the LGU have any responsibility for that, or the department? I mean, does Frank have any responsibility for that at a certain point?
Well, it may come to that, but right at this point in time, they still have a board of directors that has some responsibility for doing all of those things. So we're trying to give them support for that process. Because those records are really important. So I think they have an interim plan for their records right now, and then I'm sure they'll be figuring out what they can and cannot do. And I know Oasis is meeting regularly to give them guidance. So they're not just trying to, you know, figure it out as a board.
Okay.
Yeah, it's a lot of an undertaking.
Larry, a lot of your concerns also are my concerns at the last substance use subcommittee meeting, last meeting I was in California. But at the subcommittee, I was in the air, I think, 30,000 feet. So I was really disappointed that I wasn't able to attend that, but next week we have a meeting, and I think a lot of your concerns and my concerns are going to be aired out at the meeting if we have enough time to be able to elaborate your concerns. I think you're on the same page with me when we talked last time about it, of the need for the big gap right now. And there was a gap before, and it's a humongous hole since they left. But it's, you know, it's ongoing. It's not much we can do now.
It's gonna take some time,
Yeah.
yeah, to figure out how
Piece
to
by
move
piece.
forward, yeah.
It's a little after 7, so we should wrap up. I just want to mention, I hope that everyone read the email from Mary about needing some board representation, particularly on the substance abuse subcommittee, or substance use, I'm sorry, and then developmental disability. So if anyone has an interest in that, you can contact Stu or Mary or I, and we can give you a little information. Other than that, do I have a motion to adjourn? All right.